News Channel 5's Claire Kopsky is here as we're talking about screen time.
And over the past decade, we've all been using more and more screens and spending more time plugged in. But unfortunately, Claire, that includes our kids as well.
It does. I'm sure, Ben, you probably have a hard time keeping
No
Harper away.
doubt about it. It's very hard. And I even found myself needing glasses now because of this.
Absolutely. Well, and this is what new research is showing, that nearsightedness, also known as myopia, increased in kids during the pandemic. That has doctors here taking a closer look at how to prevent a further decline.
When Dr. Stephanie Gian looks through these lenses, she's not just looking for 20/20 vision.
Over the last few decades, more and more children are becoming nearsighted, or they have myopia. And this is a trend that we're seeing across the world. We know that when kids become nearsighted, there's some genetic components and also some environmental influences, but it seems really likely that over the last few decades, this significant increase is coming from environmental influences.
A trend that, although has been on the rise, saw a spike after the height of the coronavirus pandemic.
There are a few large-scale studies, mostly out of China, where they started lockdown sooner, showing that after COVID lockdowns, more children became nearsighted.
Although the data is still coming out, Dr. Gian says the culprit seems to be these screens.
There are more and more people who need glasses to help them see better. And what we worry about from a health point of view is that people who develop really high amounts of nearsightedness are at greater risk for some eye diseases.
Dr. Gian says she knows screen time is unavoidable for kids, but there needs to be a trade-off.
I think it's a combination. It's just, I've heard from families that, well, during virtual learning and this year, there's just been a greater trend to putting the kids on a device and leaving them to it. And that's what is not good for maybe their development, and more importantly, from my point of view, it's not good for their eyes.
At the Vanderbilt Eye Clinic, her team is doing some myopia management treatments on pediatric patients.
There are eye drops, low-dose atropine eye drops, some contact lens options, potentially in the future some different designs for glasses that will help to slow down that progression of nearsightedness, which is very exciting. And then hopefully in the near future some spectacle glasses lens designs that are already being used in other parts of the world, still working on getting access to them here in the US.
A new normal thanks to a digital culture she says parents can help prevent.
I always recommend regulating screen time, but across the board, I think taking breaks from that in your work is good. Do something else with your eyes, and then if you want to go back later and go back to reading or on the tablet, that's okay, but trying to take breaks from staring up close for too long.
Well, we all know that keeping kids off screens at home and out and about isn't easy, but with an increased virtual learning moving forward in schools and other places, it's something to think about. For more tips from Dr. Gian, click on this story on newschannel5.com.